We're back on America's Forum. John, I understand there's some breaking news.
Yeah, a couple updates to some stories we've been following today. We're talking about Janet Yellen in a press conference. She made it official that she's going to go ahead and cut the quantitative easing program by $10 billion, bringing it down to $55 billion a month. For that asset and bond buying program known as quantitative easing. Yellen making the announcement official today at her first news conference as Fed chair. Also out of the Ukraine, a new report coming in from multiple sources. Apparently, Ukrainian officials and authorities are going to go ahead and start pulling their troops out of Crimea, as well as ethnic Ukrainians who live in that region. And that's the next step so far in this crisis. We'll see where it goes from here, JD.
And we will continue to monitor that. Meantime, a new National Center for Policy Analysis study shows we can save an equal amount of money on Medicare without cuts or jeopardizing access to care. Over the next decade, the so-called Affordable Care Act, Obamacare, will cut Medicare spending by $716 billion, primarily by reducing payments to doctors and hospitals. By 2060, 1/5 of Medicare will be gone. The Medicare actuaries and others have warned that these cuts will reduce access to care for seniors. The proposed reform consists of two changes to current law: raising the Medicare eligibility age to the same age as Social Security and requiring higher income seniors to pay a greater share of their medical costs. And to talk about the plan that, as it was headlined, is a plan, quote, everyone can love, we've got senior fellow Tom Saving. He's the senior fellow of the NCPA. Tom, we're glad to have you on America's Forum today. Tell us why you believe people could get behind this plan with relative ease and such affection.
Well, I think the first place you can do that is that both sides of the aisle have exactly the same goal for the federal participation in Medicare. Now, bear that in mind. That's not what seniors are going to spend on health care, but it's the amount that taxpayers are going to pay for. And that's what, and both sides of the aisle have exactly the same goal. That was true in Paul Ryan's notion. It's true in the president's budget. Everyone wants to have federal expenditures on Medicare go up no faster than GDP, or perhaps slightly above the rate of GDP growth, something that has not happened in a very long time and is not going to happen even with the proposals that you might have, considering the fact that we're going to have a huge amount of baby boomers getting into Medicare. However, we're going to be able to control that with two things, as you pointed out. One of them is change the retirement age to match Social Security, something that's been in many proposals for a very long time. And the other one is a form of means testing, something that progressive indexing, as we called it when I was on the President's Commission to strengthen Social Security. It's a way of leaving the lowest income people untouched in terms of getting the regular benefits, and everyone above that paying something more than they're currently paying for those benefits.
Well, let's drill down a little bit more on this, Tom. And as you were mentioning Social Security age, maybe it's one of the big secrets, and maybe you can clear this up for me because you're a policy guy and horrors. I'm just a recovering politician, former member of Congress. The way I always heard this was back in the 80s when Tip O'Neill and Ronald Reagan got together. They, in essence, raised the retirement age for guys in my age group. I'm a 1958 baby, but this notion of retirement at 65 for my generation is not the fact. The retirement age has already been raised. That's one point. Am I accurate in my understanding there? The second point, in terms of political reality, when you outlined what we call in shorthand a means test, you hear a whole lot of seniors saying, now, wait a minute, I paid into Medicare. Shouldn't I get the same rate back? And now you're gonna take that away from me? Politically, isn't that going to be a tough sell, the means test?
Well, I don't think there's any doubt that one of the issues that we've had all along, Medicare is less susceptible to this than Social Security. When FDR started Social Security, one of his real quotes was, we put this, remember FICA's called a contribution, not a tax. But we put that tax in there so that the public would believe they were paying for their retirement, when in fact, of course, they're not. They're paying for the older people's retirement. They're not paying for any of their own. This is a pay-as-you-go program. Medicare is a pay-as-you-go program. But the notion that we've been paying these premiums, so to speak, does make it appear as if, and I think that does affect us politically, and that's why all the things that we've done here in assessing how much of these benefits can you take away and to whom you can take them away says you can't take away the benefits from anybody who's currently retired. And no Congress is going to do that. There's no doubt about that. You remember when you were in Congress, you can't do anything to the old people. As I tell my students, they do two things the students don't do. They vote and they give money to politicians.
Very astute observation, Professor. You're right about that. That's the political reality. And yes, seniors vote, and so everything is tailored around that.
Some Republicans.
That's why we have to delay these changes. But that's what every proposal to change these things does, exactly that. It delays the changes so nobody younger than 55, for example, is affected. I mean, older than 55. Take the people who are close to retirement, already retired. We're not going to do anything bad to them. Well, but right now, the deficits are small enough we can handle them. Now, as we get further out, we can't. So we've got to change the program, and we're going to affect those younger people. We're going to gradually let the retirement age rise to meet Social Security, but only by 2027 would it be there. And remember, Social Security is going to have a retirement age, a full benefit retirement age of 67 in 2022. Well, and this is 5 years later than that. Medicare would catch up with it.
Well, one thing we've seen the impact early on in this election year is the impact those Medicare Advantage cuts had in the special election in Florida's 13th congressional district a couple of weeks ago. Now, what is the difference between these Medicare Advantage cuts that have been forced by Obamacare so far and the means testing that we hear some Republicans talk about? You said there were some similarities in the way they felt about this.
Well, I think one thing is that the means testing solution only is going to apply to higher income people. It's not going to happen immediately. So it's not like tomorrow you're going to go out and say, we're going to do this. We're going to do it much later, which is going to allow people to prepare for it. This progressive means testing is, I think, something we're going to wind up doing anyway. Of course, the people who are going to be unaffected, the lowest 30%, a third of all those people are on Medicaid anyway. And so they actually are going to get the same thing no matter what we do with Medicare. But the thing that we cannot do is what's in the Affordable Care Act. And that is we're not going to accomplish this by reducing payments to physicians. We know, in fact, SGR is about to go away with a permanent doc fix. And ultimately, there's going to be a permanent fix to the productivity adjustments that are in the Affordable Care Act. So none of that's going to happen. The trustees recognize that that is all fiction. And so now what you're going to have to deal with is how much health care are seniors going to consume? How are we going to pay for it? Who's going to pay for it? Taxpayers or seniors?
Tom Saving, we thank you for your plan on saving Medicare and your astute observations. We look forward to our next visit with you coming up real soon. Thanks very much.
I will love it.
And a lot of head-scratching questions at the end of that interview. And of course, we'll have to keep following this issue as well. We want to weigh in, or we want you to weigh in on the discussion we're having here on Newsmax TV on America's Forum. You can reach us on social media at Newsmax TV, hashtag America's Forum. Connect at NewsmaxTV.com or find us on Facebook, facebook.com/Newsmax TV. Back with more right after this.